and also stopped by indomethacin. I mean, don't forget that mostly when people have a cough with ACE inhibitor, that drug is stopped rather than yet another drug prescribed in order to stop the coughing. However, we know that aspirin and indomethacin stop ACE inhibitor cough. So our proposition is that both these drugs would work in early COVID infection as well. So we were much intrigued when we read of the report that you had helped publicize in the BMJ from Dr. Leibovitz and colleagues in New York, that he had been using indomethacin in over 60 people with remarkable results. We also spoke with Dr. Leibovitz and Dr. Rothstein, and they confirmed that it had a rapid effect on the cough and also an effect on the general well-being and other pain suffered in COVID-19, because it is a painful condition. There's a lot of chest pain. I don't think so. With our suggestion that the reason why indomethacin works is because of bradykinin would apply only to aspirin, but not to other NSAIDs. And in fact, Dr. Leibovitz had already discovered in his clinical practice that ibuprofen didn't work at all.